Hi, I'm Dr. Felice Gersh, your integrative OBGYN doctor. And for this episode, I'm going to talk to you about my second favorite hormone, but one of vital importance. And I joke about it, but it honestly is really, really important. And it's so minimized. It's so forgotten. In fact, most women after menopause, if they don't have a uterus, they're told you don't need it. You don't want it. Don't even think about it. What hormone are we talking about? Progesterone. The initials, P, a capital P, and the number 4, progesterone, a critically vital hormone produced by functioning reproductive aged ovaries. Now, there are other places in the body that make progesterone, but not for distribution. For example, progesterone can be made in the adrenal glands, and it's used to be converted into other hormones from it. In addition, it's made in the brain. It's so important. The brain has the ability to even make progesterone, but not enough for women if they have injuries or just aging processes happening in the brain. So we'll talk about it because every woman's ovaries are on a deadline. They're going to stop working, and the decline in progesterone occurs long before the final menstrual period, which we define as menopause, 12 consecutive months without any bleeding from the vagina. However, that is end-stage ovarian aging. And the loss of progesterone is really critical, and it declines with the aging process. And there are other times in a woman's life, earlier in younger women, where they may have progesterone deficiency. So progesterone deficiency happens 100% of the time naturally, but not for good, not for benefit to women as they go through the menopausal transition, and then they have absolute progesterone deficiency after menopause because the ovaries stop making it altogether. Now, progesterone, I'll tell you a little bit about it, and then what groups of women tend to have progesterone deficiency states, and what can we do about it? Well, first of all, what does progesterone do in the body? Many, including board-certified OBGYNs, think that its only purpose is related to the uterine lining. They think that what it does is, in a menstruating female, it prepares the uterine lining for a pregnancy. And yes, it does do that, but it does so much more than doing that. And of course, if a woman doesn't become pregnant, and so she doesn't actually need the uterine lining, it will shed. The progesterone production drops, and then the uterine lining sheds out. But progesterone also, OBGYNs recognize, is an important hormone produced not just by the ovaries. I should make this clear. It is also produced by the placenta in women who are pregnant, and only during the time that you actually have a functional placenta, which starts when it can take over from the ovaries. So let me go over a little bit of background here about how it comes to be that the ovaries make progesterone, and then how it comes to be that you make it in a placenta. But then what does it mean to all the different organ systems of a body, and what happens when you don't make enough? Well, in the ovary, let's talk about how progesterone comes to be. The menstrual cycle, that beautiful rhythm of hormones of healthy reproductive aged women, goes as follows. The first day of the menstrual period is called day 1. It's the first day of any bleeding. So that's day 1. From that day, you start to rise in the production of estradiol. Estradiol, E2, the estrogen produced by reproductive aged ovaries. So you now start from where you are when the period starts at a very, very low level of estradiol production and no progesterone. So the estradiol production rises during the first 2 weeks of the menstrual cycle. From the uterine perspective, it's called the proliferative phase because estradiol causes growth of the uterine lining called the endometrium. From the ovarian perspective, it's called the follicular phase, those first 2 weeks, That's when the follicles that contain the eggs are being recruited. Now, when you get to mid-cycle, you get this around day 12 in a 28-day cycle, you get this giant surge of estradiol produced, which then triggers a big surge of luteinizing hormone, LH, from the pituitary, and that will trigger ovulation, where an egg is released, and hopefully in someone who wants to get pregnant, it will get taken up by the fallopian tube, the end, the fimbriated end. It will work its way down into the uterus, but while it's en route in the fallopian tube, it will get fertilized by a sperm. That leads down that whole path of making a baby. Now, what happens getting back to the uterine lining and the ovary? Well, after you ovulate, the special cells, the granulosa cells of the ovary that produce the estradiol become what is called luteinized. They are transformed. It's like a miracle. And they form what's called a corpus luteum. It's a little structure in the ovary. You make one every month after you ovulate, and that structure makes progesterone. But as I said, if you don't get pregnant, if you don't have a fertilized egg, that corpus luteum will involute. It will shrink and it will no longer produce progesterone. End of story. You then have a period and you start over again. Well, that's what happens in the ovary. What about in the uterine lining? Well, after you ovulate and you start making the progesterone, the uterine lining stops growing or proliferating, which estradiol triggers growth from growth factors, and it stops growing, and it's like flowers and blooms. We call that secretory. It makes mucus and glands, and it just like flourishes in preparation for a possible pregnancy. And once again, that will all shed out if a pregnancy does not occur. It seems so simple. It seems like that's all progesterone does, but not true. Because in pregnancy, progesterone is vital to keep the immune system from killing off the fetus as an alien. It also has to keep the uterus from contracting and creating an early labor. It has to help to maintain bones and brain health and vascular health. So it's about sustaining life. And these functions are throughout the body, and they occur with the presence of progesterone, whether a woman is pregnant or not. So let's look at what happens with the immune system. Well, progesterone is anti-inflammatory. That's really important to know. It's anti-inflammatory. There's a lot of data on progesterone involving the immune system. It actually reduces the production of pro-inflammatory cytokines. It reduces the production of pro-inflammatory prostaglandins. That's what incites the onset of labor in a woman and a menstrual period cramping in a non-pregnant woman when she's having cramps and is pushing out the uterine lining. All of that is controlled, so you don't have the wrong kinds of terrible cramps with a period. You also don't have labor when it's not the right time. And there are receptors for progesterone, just like there are for estrogen, on the immune cells. And high levels of progesterone in the luteal phase, that second half of the menstrual cycle. The luteal phase is the way that we talk about the second half of the menstrual cycle from the ovarian perspective. Remember, it makes a corpus luteum. And secretory is the way we refer to the second half of the menstrual cycle from the uterine's perspective, because the lining becomes just sort of very secretory, like it's very full of life and mucus, and it's like proliferating in the sense of creating not thickening, but rather more glands and mucus. So we call it secretory, the transformation from proliferative to secretory phase. So what happens is that the specialized immune cells of the body, they are very active. And for example, in women who develop endometriosis, they do not have proper function of their progesterone. they tend to have resistance of the receptors. We call that progesterone receptor resistance. And high levels of progesterone in the luteal phase or secretory phase, the same, of the menstrual cycle, they actually increase the activation of the receptors on the immune cells for another type of signaling agent called the endocannabinoids. Now, we'll discuss that perhaps in the future, not so much today, but just to know that by getting the activated endocannabinoid receptors on the immune cells, it keeps them from exploding with inflammation when retrograde menstruation occurs and you have this toxic and dead and all kinds of junk really from the uterine lining that should come out. Always in every woman, some of it comes out the fallopian tubes, like backwash. We call it retrograde menstruation, and that tissue gets into the pelvis. Well, it's like really dead and dying and yucky kinds of tissue, and it will do what it always does whenever you have dead or dying tissue. It promotes an inflammatory response. But in women, normal, healthy reproductive women, their immune system is dialed down by increasing the endocannabinoid receptor function and activation on the immune cells so that they don't become as explosive, and they're going to just gobble up those dead cells without creating an explosive inflammatory process. But that isn't properly regulated in women who go on to develop endometriosis. So many times they're treated with progesterone. The problem is the progesterone receptors aren't working properly. So we don't get the benefit that we wish we would. But endometriosis is not the topic for this. But I want you to know progesterone is really critically important for regulating, down-regulating the inflammatory response of immune cells. And of course, like I said, in a pregnancy, that is so important so that those immune cells are kept kind of quiet. They can do their job so reasonably to try to protect the mom from having a life-threatening infection, but not to the point where they're going to attack and damage and kill the fetus. So think of progesterone as what it is, anti-inflammatory. So what about the brain? We now know that progesterone is neuroprotective. It actually helps neurons to survive. It helps to create a healthy myelin sheath. That's the coating or insulation of nerves. So it works both in the central nervous system, the brain, and in the peripheral nervous system. So for the health of neurons, for the functionality of neurons, for the survival of neurons when there's trauma to neurons, like brain trauma, progesterone is really important. There's even studies that show that intravenous progesterone, and most of these studies were done in other animals, lab rats, but they have a lot in common and they're living creatures. And we do have human data too, but a lot of it is coming from animal data, that if you traumatize their brain, which we're not going to do in humans on purpose, that what happens is if you do an IV infusion of progesterone, it limits the inflammatory damage because you get a second hit after brain trauma. You get inflammation and swelling of the brain. Intravenous progesterone can dampen down that effect, and it quiets down the immune cells so they don't create an overexplosion of inflammation in the brain. What else? Well, think in pregnancy. You don't want the uterine muscle to contract. So I mentioned that it keeps the uterine muscle calm. So how does it do that? It's actually a muscle relaxant. So it keeps muscles from contracting a lot. And how is that potentially beneficial? Well, in a menstrual period, it keeps the uterine lining enough contracting with the muscle around it to expel, but not so much that you have severe menstrual cramps. So it's very important to know that also because it relaxes all the muscle, including the muscle that is involved in the intestinal tract. So it can actually cause some decrease in motility, okay? But interestingly, in some women, it can actually promote more increased diarrhea. So Each woman may have a different response, but keep in mind it tends to be a muscle relaxant. It also tends to loosen things up a little bit. So there is some data that women who are active in sports may be more prone to injuries when they do extreme types of exercise in the luteal phase, when things are more stretchy, because in pregnancy, things just have to be more stretchy. Think of how a baby gets delivered. Everything has to stretch. So it's amazing. It actually makes things more stretchy. What about body temperature? Well, most women in the old days, when we had basal body temperature thermometers, progesterone would raise the temperature a little bit. So it's working through the brain. It works in the body to have this mild effect on temperature. And what about bone? This is an under-recognized issue for progesterone. There's data showing that progesterone is pro-bone growth in a good way. The osteoblasts are the cells of bone that make new bone. And progesterone helps to modulate them so that they will actually work better. They have done studies showing that women who do not ovulate regularly, so they do not make progesterone, a woman who does not ovulate cannot make progesterone from her ovaries, or she ovulates infrequently, or she has a suboptimal ovulation, so she has what we would call a short luteal phase or an insufficient luteal phase. She doesn't make enough progesterone during the luteal phase. She will have less bone development, so she will not reach her peak bone mass that she might otherwise have reached. Now, what about in postmenopausal women? There's published data showing that women who take progesterone along with estradiol will get better bone development than just estradiol alone. Progesterone is really important and may tip the balance in favor of bone health and prevention of what? Of bone fractures. So it increases the proliferation or number of those osteoblasts, the bone creating cells, and it helps to create better functioning osteoblasts. So it's really critically important because so often women in menopause who don't have a uterus are told they don't need progesterone. That is totally inappropriate. And what about cancer? Well, it turns out that women who have regular cycles and have progesterone being produced in adequate amounts have a seriously significant reduction in cancer deaths from a whole variety of cancers. Progesterone is cancer protective, and they have a lower incidence of breast and ovarian cancers. Now, there's so much misunderstanding about what is progesterone and what is a progestin. A progestin is a man-made chemical that can bind to progesterone receptors. But guess what? It's not progesterone. Technically, it's a progesterone endocrine mimic. It's not real progesterone. You can consider it as an endocrine disruptor. So it can bind to progesterone receptors in some organs and act like an on switch. But in others, it may bind to the receptor but act as an off switch. And this is the whole thing with the Women's Health Initiative, where they used medroxyprogesterone acetate. That is not progesterone, even though it has it in its name. It's a different molecule. And that particular molecule, MPA, medroxyprogesterone acetate, it turns out it increases breast cancer. But there are studies that show this, real estradiol plus real progesterone, human bioidentical progesterone, lowers the risk. It certainly doesn't increase the risk. So this is really important. At least it doesn't increase. And we need more data to for sure say that it reduces it. But when you understand the mechanisms, it should, because it is protective. It's anti-inflammatory. It takes care of female bodies. It's not there to hurt us. Up until approximately 1996, there was no good way to deliver human bioidentical progesterone to the female, because if taken orally, it got digested. It just didn't get absorbed. But back in the late 1990s, they discovered a process called micronization, and they could then produce micronized progesterone to be taken orally. And when that happens, guess what? It gets absorbed. And a lot of women love taking their progesterone orally because it has a greater effect than even when you give it transdermally on another aspect that many women love from progesterone. It reduces anxiety and it promotes sleep. So many women say their best sleep is when they're on their progesterone 2-week therapy, when they get pulsed progesterone. It reduces anxiety. It works by increasing GABA, the neurotransmitter / amino acid that helps promote calmness and sleep. It's like the calming neurotransmitter of the brain. And women often love that feeling. Overdosed, it might be like you feel like you're in a bit of a hangover, so you have to be careful. And not all women can tolerate oral progesterone. There's a small percentage that have either an sort of an opposite effect, or they feel, like I said, sort of like a hangover, or they feel drugged because it's too much GABA type of thing. For them, we can give bioidentical progesterone cream. Now, we don't have tons of published data, but there's no question it does get absorbed, but you have to use quite large quantities. So you have to give a very large dose, but there is actual quite robust data on pregnancy, on giving progesterone vaginally. That's basically topically. It's absorbed through the skin of the vagina, and we know that it absorbs. There's even a commercial product for use in helping to sustain pregnancies using this commercial vaginal progesterone product. And I know from personal experience with patients who don't tolerate the oral version or just prefer the cream that we can dose them to get really good response in the uterus, to protect the uterus from what we don't want is unopposed estrogen. They're a team. You always want to give progesterone and estrogen. And I want to end by just mentioning, when we give progesterone to postmenopausal women, we want to give it pulsed. We don't want to give it continuously because there's this beautiful interrelationship between estradiol and progesterone. Estrogen in the form of estradiol upregulates its own receptors and the progesterone receptors and the testosterone and the thyroid receptors during the first half of the menstrual cycle. And then when progesterone comes on the scene, it downregulates estrogen receptors and testosterone receptors. It downregulates them. And you don't want to downregulate your estrogen and testosterone receptors all the time. You don't want to do that. You want to have this beautiful flow, this beautiful interrelationship. And I wanted to mention one other property of progesterone I almost forgot to mention, is that it has anti-mineral corticoid effects. Now, what is that? Mineral corticoids are adrenal steroid like aldosterone. That what happens with them is they're part of the pro-inflammatory response, and it causes fluid retention and constriction of arteries. As an anti-mineral corticoid, progesterone helps to relax arteries, so it's anti-hypertensive, and it acts as a mild diuretic so that you will pee more, okay? You get out of your body excessive fluid, like that makes you swell. The intracellular fluid stays, but the extracellular fluid you can get rid of. That's what causes edema. So it helps to get rid of extra fluid. It helps to keep arteries nice and relaxed. So there are just a host of benefits of progesterone. But you want to give it pulsed because you don't want to downregulate receptors for testosterone or estrogen all the time. You have to have this ebb and flow. And so you do have a period. So women who don't ovulate regularly, women with PCOS, or women on birth control pills, or they're not ovulating at all, they don't make any natural progesterone at all while they're on that drug. Understanding that progesterone is not just about shedding the uterine lining. It's about bone health, immune health, brain health, maintaining proper function of our vascular system. It's about our brains being happy and calm and good sleep and neuroprotective. Progesterone, like estrogen, like estradiol, is another hormone of life. Thanks so much.